Hi, I'm McKenna. I'm a student nurse and I'm going to be demonstrating how to give a medication via central line. So the first thing you're going to want to do is check your MAR and check your order. So I have Bob Owens here who is admitted with pneumonia. He has a PICC line in place for his chemotherapy due to his lung cancer. So that's why we're going to give the med the central line way. And he is reporting a chest pain of 8 out of 10 that is currently getting worse. So Bob is due for hydromorphone. We know he has an allergy to morphine, so he hasn't had the hydromorphone at all today, so we can go ahead and prepare to give him that. So the first thing I'm going to want to do, wash my hands. I am then going to get my med ready. So after doing my math, I know that I'm gonna let that dry. He needs to get 0.5 mLs to equal that 1 milligram IV push. Because I have hydromorphone 1 ml per 2 milligrams, so doing my math, I have 0.5 mLs for 1 milligram that I need to give. So I'm just gonna go ahead and get this ready. So I know the top of this is dry. I'm going to go ahead and hook and get dose accurate here. Okay, so it looks like I'm accurate. You want to go ahead and look, 0.5 mLs for a dose of 1 milligram IV push. Okay. So what I'm going to do right away is I'm just going to go ahead and label the syringe before I go into the room.
And then some of the other random stuff, it's like, in real life, you're probably doing it and thinking about it, but as a student, so
Okay, so I'm just going to do one of my checks before I go ahead and go into the room. So I have Bob Owens, who has a pain of 8 out of 10, requesting pain medication. He does have a hydromorphone 1 milligram IV push every 3 hours PRN for pain. He has not had it at all today, so I am going to go ahead and get that. So I do have hydromorphone 1 ml per 2 milligrams for a total dose of 0.5 mLs for a dose of 1 milligram IV push for Bob Owens. He has not had it today, so he is due for it now. So we're gonna go in the room now. So knock knock. Hi Bob, I'm McKenna. I'm a student nurse here today to give you your medication. I'm gonna provide privacy. I'm gonna wash my hands.
is that okay, or is it not okay? Yeah.
Bob, can you go ahead and verify your name, full name, and your date of birth for me? Bob Owens, 9/22/33. That matches his armband and it matches my chart. Bob, are you aware of any allergies you may have? He says, yes, I have an allergy to morphine, and so we're not giving morphine, we're giving the hydromorphone. Okay, so what I'm going to do now is just do my 5 checks.
But you'd have to send out.
So I have Mr. Bob Owens. I have hydromorphone to be given PRN 1 milligram IV push every 3 hours for pain. He has not had it today, so we can go ahead and get that now. I have hydromorphone 1 ml per 2 milligrams. After doing my math, I know I need to give 0.5 mLs for 1 milligram IV push every 3 hours. So I have Bob Owens, who is due for hydromorphone 1 milligram IV push every 3 hours PRN for pain. He has not had it at all today, so he's due for that now. I have hydromorphone 1 ml per 2 milligrams for a dose equal to 0.5 mLs for 1 milligram. Due now. I have Bob Owens, who is due for hydromorphone 1 milligram IV push every 3 hours PRN for pain. He has not had it, so we are able to go ahead and give that now. I have hydromorphone 1 ml per 2 milligrams for a dose of 0.5 mLs to equal the 1 milligram IV push 3 hours for pain. Okay, so I'm just going to go ahead and wash my hands again.
Okay, when they say they're done with everything.
some gloves on. And Bob, you know why you have that central line? Due to your chemotherapy treatment. He says, yep, I get why I have that. He knows why we're giving the pain medication and understands the use of it. So now I'm just going to go ahead and assess the access device. So I'm looking for redness, no edema, ecchymosis, drainage, and it is very well approximated and the dressing is intact. So we can go ahead and give that medication. First thing I'm going to do is just check the expiration date on my saline flushes. They are not expired, so we can go ahead and give those. First thing I'm going to do is just remove the air.
That would be written somewhere in 4 exact steps for it to be fair and consistent. Otherwise, you run into issues where somebody would prompt a little bit too much, or the way that they worded it or something, and then it wouldn't be fair.
I'm going to go ahead and clean the access device. And you want to make sure you have selected the right line, not giving it in a TPN line. So I know this is not the TPN line. So the first thing I'm going to do is go ahead and flush. I'm going to attach that, and you wait for this to dry. And then your pre-flush, you're just looking for patency, making sure that you don't have any resistance and that the flush runs through just fine. And you flush for however much your facility calls for. In this case, our facility says we flush with 10 mLs before. So go ahead and clamp that again, and I'm going to remove this. I checked my Betty book to know that my medication does not need to be diluted and it is to be given over 2 to 3 minutes. Looking for signs of hypotension and respiratory distress. So I'm going to go ahead and clean my port. Oops. In real case, I would not use this. I would grab a new one.
Stuff
But
that you may or may not actually learned about the other stuff related to it.
so being careful not to touch that,
I was like,
we can go ahead and get ready to give our med. So we're going to attach after it's dry. And like I said, we can give the full amount unclamp over 2 to 3 minutes undiluted. Making sure not to give it any faster than the 2 to 3 minutes. Looking for adverse reactions. We're going to say we gave it over 2 to 3 minutes due to time. Ask Bob how he's doing, if he feels any different. He says he is doing good. He does not have any dizziness. So I'm going to go ahead and clean again. And then we're going to take our second flush. Flushing for the same amount of time as you gave your medication, because there's still meds in the line and the point is to flush it out so they get the full dose. So per facility policy, you flush with however much they say. In this case, we're going to say 10, giving that over the 2 to 3 minutes. Still monitoring for adverse reactions. So if it was a PICC line, you would want to make sure you're doing the pulse technique. And we're going to say that we gave this over the 2 to 3 minutes. Go ahead and clamp. Clean for the last time.
No, I'm not worried about that. I'm asking if we have to change this.
All right, Bob. We're all done. Are you feeling okay? Bob says I'm feeling fine. You're just going to want to maintain safety. Put the bed at the lowest position. Give the patient the call light. Clean up your mess. Wash your hands. And documents. So what I would want to document is time, date, how the patient handled the medication, the amount given, which route you used, and then you would want to come back in about 10 to 15 minutes, check some vitals, reassess the pain to see if that med was effective or not, and chart that assessment then. And for lifetime considerations,
That you never see, yeah, so it's like
you,
sepsis, okay.
for a younger child, the dose may be different. You want to make sure your dosing is accurate for the person you have versus a younger patient and an older patient. They may be able to have more, children may be able to have less. So, and I think that's all.